my name is Lori Wong, a clinical pharmacist at the VA, here for 3 years, here to give you tips on medication ordering. Medication reconciliation is essential to obtain an accurate medication home list. A gold standard is best to obtain, given the medication, the dose, the frequency, and then double-checking compliance utilizing the medication reconciliation tool, also known as AviTrax. This can be found in CPRS under Tools. In CPRS, you can also transfer outpatient medications to inpatient via the Meds tab by highlighting and then going to the Action tab. When choosing a schedule, the default schedule is Q day, which is at 10 a.m. If the medication is ordered after 10 a.m., the medication will not be started until the following day. If an additional dose is needed, check the Additional Dose Now button. When choosing the route, it is important to indicate if the medication is going to be administered via a tube, so the appropriate checks can be completed to assure medications can be crushed. There's a complex medication tab at the top to order tapers and titrations. To schedule different dosages for different days, you can utilize the week button up at the top next to the schedule. When all else fails, utilize the comments to communicate what you want, such as time 12 hours after the emergency dose was given. Regarding the priority of medications, utilize the stat button conservatively. This is intended for use in life-threatening situations. The ASAP button can be utilized for urgent medications intended for administration within 90 minutes. Everything else can be utilized using the routine button. Some medications are restricted, and those can be entered through the Notes tab in CPRS. You can addend a completed note or start a new note and enter as a title of your choice, such as Inpatient Medicine. Then select the Templates tab, Shared Templates, and choose either the antipsychotic medications for Ann Arbor or the restricted medications such as ibuprofen. Certain medications are also restricted to infectious disease, such as fluconazole, cefepime, fluoroquinolones, oral vancomycin. When needing these agents, please page the ID fellow or ID staff. When you have obtained approval, enter the approving physician in the comments of the order. There are also non-formulary drug requests. When searching for a new medication, if you notice that there is an NF behind the name of the medication, then a non-formulary drug request is needed. This is entered via CPRS in the Orders tab under Inpatient Pharmacy Orders, Non-Formulary Drug Request. The consult will be assessed within 96 hours, but to expedite, please contact your team pharmacist. There are also therapeutic duplications when ordering medications. So when you have PRN medications that have, you must have an indication per Joint Commission, so first line versus second line. So if you have Miralax and Senna, for instance, you could say Miralax first choice, Senna second choice for constipation. For pain scores, each pain medication needs to have a pain score, such as mild, 1 to 3, moderate, 4 to 6, or severe, 7 to 10. Topical agents need a location for placement. Providers manage the anticoagulation here at the VA. Pharmacists assist with selection, dosing, and education of these high-risk medications. The team pharmacists follow all patients on anticoagulation and provide recommendations. Patients on warfarin should also be on a low vitamin K diet. If on tube feeds, they should be held 1 hour before and 1 hour after the warfarin dose. Please assess the need for aspirin or clopidogrel in addition to an anticoagulant. If needed, consider adding stress also prophylaxis. Upon discharge, enter an outpatient anticoagulation consult. It will be forwarded on to the correct anticoag clinic. Last but not least, when thinking about discharging a patient, it is important to alert your team pharmacist as soon as possible. AviTrax should be completed for the pharmacist to be able to process the outpatient medications. You can transfer new medications to outpatient via the Meds tab. You can highlight the medications, select Action, and then transfer to the outpatient. Controlled substance prescriptions will need electronic signature with your PIV card. If there are issues with signing controls, please contact Cindy Shepler at 53527. If the patient is going to the CLC or a long-term care facility, there's no need to order outpatient meds. In AviTrax, select patient going to facility and choose the inpatient meds to be continued. For patients going to rehab or for a short duration, transfer only new medications to outpatient and select pickup location for mail. For patients going home, transfer only new medications to outpatient and select pickup location as the window. For patients needing paper scripts, in Avitrax you can select prescription box behind the medication, and when finished you print via the prescription pad under the accessories button at the top. I hope these tips will help make your rotation more successful here at the VA. Thank you.